key thing that I try to do in a case is actually overturn the diagnosis. And I'll do this rigorously. And I want to see if the pathology report fits what's maybe transpired. So many of the cases I deal with are people who were diagnosed months or years before even. And sometimes in hindsight, it becomes evident that the diagnosis is in question because, as it were, the cancer didn't behave as it typically would, or more importantly, the treatments that would normally work for that diagnosis, that cancer, haven't worked, which right away suggests that maybe the diagnosis was wrong.
And that's not so far-fetched, because when Susan Braun was the executive director here, and as you know, she headed Komen for the Cure and now heads the V Foundation for Cancer Research, and one of the foremost oncology leaders in the country. And one of the things I learned from her was that the interpretation of the pathology report was one of the weak links in cancer medicine. And in fact, at many cancer centers, there's a high error rate. Yeah. And so when you say overturn the diagnosis, it's not far-fetched at all, because given that there's a high error rate and that that's a weak link, it's a very real possibility that a significant number of people have been misdiagnosed and are being treated for something that they do not in fact have.
Right. So I've done cases where a person's had a bone marrow transplant for something that wasn't cancer.
Right.
Cases where a person's been in hospice for months already when they didn't have cancer. And the things that it can turn out to be, just to sort of in perspective, you can sometimes have a cancer and then a second cancer. And the second cancer then, it's a second primary. That's what's being seen as the metastasis from the first cancer. So the person doesn't have metastatic cancer at all. They actually just have two separate primary cancers, both of which you might even have to treat differently. There's an epidemic of an unusual type of cancer that can masquerade as other cancers, and these are called neuroendocrine tumors. And by default, I've had to become sort of a quasi-expert in these tumors because most oncologists, for whatever reason, seem to know so little about them or actually have interest in them. But it really takes a rigorous analysis of the pathology report, more so actually getting the tumor specimens and testing them for whole different parameters that would rule in this idea of a neuroendocrine tumor. Often the question comes up how to do that. And just, again, pointers that are in here. It's almost impossible within the same institution to get a true independent second opinion of the pathology. So they have a lot invested in having stated their opinion, and they will fight you, as it were. But what I do is I'll research then on this given cancer or the thing that isn't quite fitting here, that it might be a variation on that cancer or something that it's often thought to be, but it's actually something else. I'll find then in the literature published work and look at what individual actually, they go to sleep at night thinking about that particular cancer and how to make that diagnosis. And and you can call them, you can email them. They're thrilled to have the chance to look at another such case. And they're happy to receive the slides and to issue a report. The key with a second opinion on the pathology is it has to be in writing. I can't tell you how often it'll be that there's some verbal report that sort of is usually kind of a rubber stamp of what was the original diagnosis, but a rigorous actual report that has legal implications. That's what you're looking for. So there isn't a single cancer case really where I don't find that getting a formal second opinion on the pathology itself isn't a good idea. And sometimes it'll go to a second or a third. I remember that course that I was telling you about. I would have one of my favorite speakers on testicular cancer was a guy, a pathologist from University of Colorado, who himself had testicular cancer. And so he sent his slides to 5 different pathologists, 5 different opinions. And he was the one who taught me. He said, look, what you want to look for in picking a pathologist is you don't even want that doctor to have trained with the other doctor. Not from that same institution, because literally it's a hand-me-down set of thinking.